Kemi Omololu lawyer, Dr. Kemi, pharmacist, journalist, and PR specialist. I'm a 30-year pharmacist trained in the United States, an award-winning pharmacist, and the only Nigerian awarded in the White House by President Bill Clinton for my exceptional ability. The U.S. government labeled me an alien of exceptional ability at the Justice Department for my work against drug abuse. And I was also honored by Governor Glendening of Maryland and the mayor at the time, Mayor Chris Schmoke, and County Executive Dutch Ruppersberger. In 1997, I did a lot of good work in America. Many of you don't know my record, but it's my past glory, but it's my legacy. Let's talk about generic drugs today. In Nigeria, I noticed that people don't know about generic drugs, and many pharmacists don't even bother to educate you. In America, where they have a health insurance system, where you go to the pharmacy, you give the pharmacist your prescription. The pharmacist is going to dispense what is called a generic drug. A generic drug is usually a drug that does exactly the same as the trade name, the brand name. The brand name, trade name is the person that made the drug, the company that made the drug. Other companies now get patents and licenses to make a cheaper form of the drug, but not necessarily a cheaper form. The same form of the drug, but cheaper. So when we see cheaper things, we think that they are not as good, and we want the brand name. I stand in pharmacies in Nigeria all the time, and I see people literally arguing with pharmacists that they wanted a drug because that's what my mother got, that's what my dad got, and that pharmacist is trying to save them money. And I also have pharmacists who care less, who will just sell them the expensive drug. A generic drug is a duplicate of a brand name drug, okay? Generic drugs are equivalent to the brand name. They have the same active ingredients. They deliver the same amount of medication to the body, the same amount of time. A generic drug is only available, okay, once the patent on the brand name expires and the brand name manufacturer no longer has exclusive rights to make that drug. Today, half of the prescriptions we have out there are generic drugs. Insurance companies in America want you to use generics anyway. We don't use that insurance system here. But people should know that they can buy cheaper. I'll give you some example. When you have diarrhea, okay, I like to use loperamide, okay? It's another antibiotic that can be used to treat intermittent diarrhea, Flagyl. Guys, you know that if you go to the pharmacy and buy Flagyl, okay, the pharmacist might tell you 600 naira per sachet. Flagyl is a brand name. Okay, there's a cheaper form, a generic for Flagyl is called metronidazole. Metronidazole, they'll tell you 100 naira per sachet. Look at the difference. If you get to a very fancy pharmacy, I'm not going to name them, but some of the fancy pharmacies in Nigeria will tell you, oh, we only have the brand name. If you come in there asking for Flagyl, the pharmacist or the pharmacy tech will not tell you, oh, you can save money by getting metronidazole. They just want your money, simple. So that's why I'm here to educate you. When you get to a pharmacy in Nigeria, you ask the pharmacist, please, is there a generic cheaper equivalent? Even though the big names I'm giving you might forget it, but just say, please, is there a generic brand, a generic cheaper? Okay, so loperamide is a diarrhea medicine. They call it Imodium. Everybody goes to the pharmacy asking for Imodium when they can ask for loperamide. If you don't remember generic names, you're not a pharmacist, we're the pharmacist. Just tell them, can I have the cheaper brand? And they'll bring loperamide to you. Okay, Imodium could be 250, 200 per sachet. Loperamide might be 50 to 100 naira. Save your money. Know about generics, okay? In America, the FDA, the Food and Drug Administration, approves all of them under strict guidelines. And that's how, NAFDAC is supposed to be doing it, but they're not doing that part yet. Because many of the generics come from abroad to start with. India and everywhere there's a drug coming from. All right. The main difference between it is cost. That's the main difference between generic and brand name drugs. Okay, as an award-winning pharmacist, I did all this stuff for 30 years, and I really want to do some of this drug education and consultation in my DM. I'm going to have consultations, okay, in the DM consultations on Instagram, where you can come to me, pay your fee, and get educated about all your drugs. Brown bag is what we call it in America. In America and Canada, we're paid as pharmacists to do brown bag Saturday. One pharmacist is working and the other one is in a room next to the pharmacy or the office and educating and counseling customers, or as we say, patients. Let me give you an example of some of the generic brands that are common in Nigeria. There are some drugs like some very popular one. Let me give you Ventolin. Okay, even Ventolin inhaler now has a generic. It'll be called salbutamol inhaler here. They sell it. I use it all the time. In America, albuterol inhaler. But let's talk about Nigeria now. Micronase is a diabetic drug. The generic is glyburide. Okay, glyburide is sold in Nigeria. All right, a lot of your drugs, okay, are like that. Amlodipine is a generic. All right, high blood pressure pill. KLNSR is verapamil. Captopril is Capoten. Different ones. Even antibiotics. Antibiotics are very, very common because I have a lot of pharmacies. I know one pharmacy, like, they won't carry the generic of amoxicillin, the cheapest drug in the world. They'll carry the brand name, so you can spend 650 naira, okay, for like one or two sachets or something. It's some ridiculous amount, okay. If you want amoxicillin, say you want amoxicillin, 100 naira per sachet instead of amoxil, okay, Beecham, that's more expensive. So get to know your drugs. What has a generic? What does not have a generic? Some drugs don't have generics, not yet. But check out all the medicines you take and try and get a DM consultation with me, okay? DM consultations are 10K. I know those pharmacists charge you 20K for it, for them to talk to you. Mine is 10K in the DM. You bring all your drugs to me and we'll talk, okay? It's better to get it from the right person. Get a video consultation or audio, whichever way you want it. I'm Dr. Kemi Olunlayo, pharmacist, journalist, and PR specialist, November 26, 2019, on Kemi Talks Health.